the Jake Giffen Podcast.
In my industry, it's better, but whatever. So prices go up, commissions go up. No problem. Same thing in that world. So I sell bigger, more expensive packages, costs go up. That means my paycheck goes up. That makes sense.
100%. Imagine this. Imagine if the price of your product or service, the inflation rate, imagine if the inflation rate of your product or service was 3 times or 4 times core inflation.
Well, there's a part of me as a business person that wishes.
Right. I mean, of course.
Right.
Of course. I mean, yes, absolutely.
From an entrepreneurial standpoint, especially over the last 4 or 5 years where inflation was 20, let's be conservative, 20%. If my prices went up 60%, I would be super happy. Let's just be.
You have a new business.
I would be ecstatic. It didn't work that way, right? Because in my industry, prices don't go up with inflation. They typically go down. The margins get tighter, not better. But in the pharmaceutical and the medical industry, over the last, let's say 5 years, inflation goes up 20, 25%. You're saying that the costs then have gone up 100%?
Yeah. So for mid-sized businesses, I mean, you see typical an inflationary rate of 6, 7, 8, 9% every year.
Right.
And it's been like that for 10 years.
God bless. Because the average inflation rate in the economy, they shoot for like 2%, 3% the highest.
That's been the target, yes.
Yeah, that's the target for growth or whatever, however they manage it. And so, and that makes sense if you understand inflation, and it's okay, fine. But 20%, you did something wrong. All right. But so if our economy is growing at an inflation rate of 3%, medical insurance and all the things that we're paying for goes up 8%, 9% a year. That's crazy talk.
It is, and it's really just chipping away at people's profitability, right? I mean, it's eroding margins across the country, and
no,
people
I feel
don't.
it.
Yes, absolutely. And so imagine this. I mean, imagine if obviously, Jake, you're not lobbying legislators nearly hard enough because you haven't convinced the government to mandate that people buy your products. What are you doing, Jake? Come on.
I know. Well, look, I mean, if I have a buddy, I have a buddy, and now in California, if you're under 18 years old and you want a driver's license, you have to show some number of hours behind the wheel driving. Right. Well, what's nice, it's a kind of a soft mandate, right? Because you don't have to have a license before you're 18. You can wait and then test and do whatever. But if you're under 18, you want a license, and it's kind of a soft mandate. I got a buddy who owns a driving school, and I go, so there's the soft mandate kind of pushes business his direction. And I'm always very jealous, if I'm being honest, because I always think, man, I need a business where the government is pushing business my direction, like pushing customers through my door. Like that's the best business. The insurance business, the insurance business is just that, where the government now, specifically since the ACA or the Affordable Care Act came into existence, but even before then, right? I mean, the government's pushing customers through the doors of these insurance companies. Is that the case or no?
It wasn't mandated by law until 2014 now we're going back to the Affordable Care Act, but the large employer mandate. And here's basically what it means: any company that has over 50 employees is required by law to provide what they call a qualified medical plan that has these certain features and characteristics to it to their employees. And they're also required to contribute at least a certain amount of money towards those plans on behalf of the employees. So yes, they're mandating that businesses over a certain level size buy this type of product. Okay.
Right.
And so it kind of puts people in a bit of a box. And while we're on this topic, real quick though, another thing that's not sexy at all but hugely foundational to our healthcare system in the commercial marketplace is what's known as the no lifetime maximum rule. Okay.
No lifetime maximum rule. What is that?
Okay. So basically, for these qualified medical plans that employers are mandated to offer to employees to buy for employees, this product, um, one of the requirements for this product is that there can be no limits on how much you spend on the patient. No limit. There's no cap. There's no cap.
All right. So what I think you just said is that in these particular plans where there's no cap on how much you can spend on a patient, in my mind, I think surgeries, do whatever you need to, spend as much, put as much resources towards this patient as you possibly can, because the money's going to come from somewhere. Did I hear that wrong? I don't know. I'm
No, you heard it exactly right. So basically, it's an unlimited. It's
a blank check.
It's a blank check. It's an
Stop
unlimited.
it.
It's an unlimited liability. Now, think about it from an actuarial perspective, from a budgeting perspective. How do you budget for an unlimited liability?
You can't.
You can't. You can't. And so the underwriters, the reinsurance people who back all this stuff and are actually the ones, that get hit with these large claims, they say they're inherently, risk adverse people. They're underwriters, right? And that's okay. It's their job. They say, oh, I'm subject to unlimited liability. That means I have to be even more conservative than my natural bias. Okay. So the net result of this law has been around since 2014. The net result of this, and I detail this in my book, is that the frequency, the number of claims that have exceeded $1 million has increased 322% since 2014.
Wow. That's crazy. Now the underwriters have to be in some form of freak out, right? Because because underwriters are they're the defensive thinkers trying to figure out how not to spend money.
How to protect the piggy bank, right? How to protect the risk pool, right? I mean, so here's what's happening. I mean, I'm sure you've heard the news. Healthcare costs are predicted to rise at record levels next year in 2026. And this is a major concern. If you go to the Self-Insured Institute of America's, conference, which I think just passed last week, I guarantee it was like one of the hottest topics was large claimants. Claims exceeding over $1 million. Now we're seeing a number of claims exceeding over $2 million. And that used to be, 7 years ago, that was almost unheard of. There might have been like 3 in the country.
Right.
Now it's becoming a regular thing.
So reverse engineer it. So I have, let's say, a claim that's $1 million. Can that be for one person for like with chemotherapy or surgeries or whatever? So myself, there's $1 million, let's say, floating around, and that's going up. And at the ratio that's going up, that's because the medical facility, the insurance companies, the brokers, and the underwriters are incentivized to increase those costs so that their payment goes up. Is that?
In a very perverse way, you're exactly right. I mean, you think about it. Let's go back to your business, Jake. Imagine if your customers walked in with an Amex with no limit on it, and they could spend as much money with you as they wanted. That's when people.
Oh my God, that's a dream. I
Exactly.
I just had like a mental euphoric event. Like like what?
Yes. Combine that with the inflation, and wow, life is good.
Yeah.
Not so good for your customers, but good for you. All right. So this is essentially when patients walk in with a legacy insurance card, it's basically walking in with an Amex with no limit on. I mean, that's essentially what's going on in a hospital setting.
Yeah.
Right. They say, whoa, oh, okay. So just to give you an example here, I live in Orlando, Florida. I'm 2 miles from, or a mile from two major hospitals. Okay. One of them charges 3.5 times what Medicare charges. They charge commercial health plans, employers. They charge 3.5 times for the same services done by the same people at the same place. Okay.
Wow.
The other hospital charges 2.8 times what they charge Medicare for the same services done by the same people at the same place.
Wow. So I'm stuck on I think there's some clarity that I need. I think that's what I'm experiencing in my mind right now. And that is, let's go back to to my customer who had an Amex card that had no limit, and they're just like, hey man, whatever you need to charge me, charge me. Reverse it from the end user, my customer with the credit card. How we know how that benefits my customer because they get the services that we're offering. But where does that, in this scenario, where would that money go then? Who's responsible for that money? How do they, you know what I mean? Like,
yeah, great question. So to understand the answer to this question, we have to talk just briefly about how a health plan actually works from an administrative perspective. A health plan is a vendor stack. There are a stack of vendors that make up a health plan. It's sold as a commoditized product, like, oh, this is just, Cigna, okay? But underneath the hood, there's a stack of vendors, okay?
Stack of vendors. So you have Aetna, and then you have a bunch of providers in that stack.
Yes. So let's just talk about the administrative functions for a second. You've got a plan administrator, what's known as a TPA, third-party administrator, who actually executes and integrates and administers all these moving pieces between all the vendors, okay? You've got your network, which, your PPO network, for example, if you're on a legacy plan. And a network, people think of a network as something that just tells you where you can go as a patient, but that's only half the story. Arguably, the more important part of a network is that it's a contract that tells how much the plan is going to pay the providers. That's what a network actually does. It's a contract, okay? So that's a really important piece, and we can go down that rabbit hole if we want to. Then you've got your pharmacy benefit manager. Pharmacy benefit manager is designed to manage your pharmacy, your drug supply chain for the business. Lastly, you have the actual insurance piece, okay? The insurance piece is what's called reinsurance or stop loss coverage, okay? This is actual insurance. This is only kicks in and pays claims that exceed a certain threshold. So for let's say you've got a 200 life group, 200 employees on the plan, you might have a stop loss deductible of, let's say, $100,000 on each member. So any member that has more than $100,000 in claims, the stop loss, the reinsurance piece, picks up everything beyond that, and it can be $2 million, right? It's unlimited what they're liable for. So some insurance carriers own their own stop loss, like the big legacy insurance companies own their own stop loss. Okay, but there's dozens of other stop loss carriers that are in the market that you've never heard of. Most consumers don't know anything about them, but they're in the market. They might actually be covered by them. Okay, so that's, at the end of the day, it's those stop loss carriers that are liable for that unlimited liability.
I think I got it. And I think one of the reasons these things are so complicated, whether you're talking about taxes, whether you're talking about insurance, is because it benefits the medical facilities, the insurance companies, the brokers, the underwriters. It benefits all these people to make it as complicated as humanly possible, so that you can't see the transactions that are happening, and an average guy like myself can't make sense of it. So with just the sheer confusing overload, your brain shuts down and goes, whatever, man.
Yes.
Whatever.
100%. And it's, I don't know if you've been following Mark Cuban lately, but it's been so wonderful having him stepping into this arena and getting really passionate about this topic since he started his cost plus drugs company in 2016.
Yep.
And he's got a great quote around this. And his quote is, where there's mystery, there's margin.
Yeah. Yeah. Well, that's a great quote because that's exactly the case. It's like, in some sense, in a home services business, for instance, if you're sitting down with a prospect and selling services, where there's confusion, there's no decision.
Yeah.
If they're confused, they'll just tell you, no, or I need to think about it. This doesn't make sense to me, right? It probably means you're not a good salesperson.
Right.
To overcome, but in the medical industry or the insurance industry, confusion is an asset because it's so complicated, Joe Schmo. You can't possibly understand it. So just pay us the $2,000 a month to insure your family, and we'll make it all. We'll give you a nice clean package that with rules that make sense for you, and then you don't have to think about it anymore.
Yeah, I mean, look at all this philanthropic work that we do, all these, nonprofit things events that we sponsor. Look at the good that we do. We're good. We have to spend billions of dollars a year telling you that we're good. That's how good we are.
Right. And what everybody should see when they're doing all the philanthropic work and all the marketing and all the other things is that money can only come from one place. That's us.
Yes.
Right. It's like everybody pays for the marketing of every service. Everybody pays for their philanthropic work. Right.
Yep.
They get the credit for being generous and loving and all these other things. And we're the ones footing the bill for the waste. And it's not, and some of that philanthropic work's not waste, but the road from end user like myself to underwriter or whatever is riddled with so many holes, money's leaking out everywhere, so that at the end of the day, the quality of the healthcare that you get that is predicated on your primary care physician prescribing or determining where you go. You're either going to go pharmaceutical, you're going to go to a specialist. He's a traffic director or she's a traffic director, right?
Yes.
So because there's so little money left with all the holes, he or she's got to see 27 patients an hour or whatever it is to make a decent living to pay off his or her debts. The level of care that you get is so completely watered down and half-assed that you don't really even know if you're getting good care or not. They're just kind of trying, in a devious, maybe in a malevolent way, they're keeping you on life support, quote unquote, to keep this money train going, I guess.
Yeah. And just a quick point on that. What we're talking about here is the medical industrial complex, right? I mean, this is.
I mean, that's it's huge. Yeah,
it's a beast. It's a total beast. And the reason that these large health systems, formerly known as hospitals, now they're health systems because they're national. There's
vertically integrated.
Yes. Oh, exactly. So the reason that they're buying independent pharmacy primary care groups, they're not buying them for their clinical value. They're buying them because once they control the primary care relationship, then they can control the flow of traffic, as you alluded to earlier. So primary care is, as Dave Chase says, primary care is like milk in the back of the grocery store. Okay.
Yeah. It's
a loss leader. It's designed to get you into the store. And on the way out, you pick up the high margin chips and all the rest of this stuff.
Yes. That is such a great analogy. All right. Sorry, I didn't mean to interrupt, but that struck me. It's the primary care is the loss leader.
Yeah.
You're going to pay your $30 copay to go in and hopefully find a remedy for this bum knee that you have. And it's not his or her job to figure out why you have the bum knee. It's his or her job to figure out if you need pharmaceuticals or if you need to go see a specialist.
Yep.
And then
that's what they're stuck with. Yeah.
And then now you're in it. Now you're in the store. It's like going to IKEA. You go into IKEA. There's no way out. You have to follow the arrows, right?
I almost had a panic attack in IKEA because I couldn't get out.
Right. Yeah. And that's the medical industrial complex. It's basically a psychological apparatus like an IKEA where they get you in the system via primary care and they do their best God, that may it implies that they're doing it mischievously, and I don't, and maybe that is the case, but I don't want to imply that is the case. It is that you get into the system, and then once you're in, they kind of don't want to let you out.
What 100%. I mean, it's only natural. And just to be clear, the physicians who sold and now are employed by a hospital, most of them are miserable. They're absolutely
Yeah.
burned out. It is real, and they
Yep.
suffer I mean, they actually have a term for it. They call it moral injury
Yeah.
because
Well,
they're not. Yeah, go ahead.
I was just gonna say, and let's give the the guys, the people who listen to this podcast, kind of another analogy of what you just mentioned in regards to these big medical facilities purchasing all these kind of independent groups. And that is so because we can all think back to a time where the Ultimate Fighting Championship, the UFC, was a fledgling organization promoting mixed martial arts. Now, I don't know if you follow that or not, but that's, a lot of our guys do. And so a good example of that is as the UFC was growing and there were other organizations growing up around it, Dana White begins to purchase all these other organizations. So he purchases Pride, he purchases whatever, FCC, purchases all these other smaller groups, and then brings all those fighters into the UFC, thus making the UFC bigger and the epicenter by which MMA is defined.
Yeah.
And so that's what's happening with the medical group. So you take a Aetna or Kaiser or whatever, and they start purchasing all these independent groups so that they become bigger and they become the apparatus by the IKEA format where you go in and you don't get out.
Yeah, you're exactly right. So, I've got a few minutes left here, but I do want to talk about solutions.
Yep.
Because we've talked about challenges for most of this. So let's talk about what can the private sector do. And this is actually the reason I wrote this book is that, listen, if you're waiting for Washington, D.C. to save you, you're going to die. Okay. It's not going to happen.
Die.
It's not going to happen. They're not, all they do is tinker around the edges and address the symptoms, never the disease itself.
Yeah.
So here's what you need to do. And because again, employers are the ones that cover $164 million Americans each year. The first step in healthcare transformation and reclaiming that $4,000 per employee per year in waste is getting unbiased advice. We already covered that hospitals, insurance companies, and brokers are all supply side sellers. They have no interest in helping you maximize your investment. So, okay, how do you get unbiased advice? There are two ways to do it. You can work with a growing number of small management consulting firms who actually serve as a fiduciary to you. They specialize in healthcare financing and procurement, and they have a contract that says that they are a fiduciary to you, just like if you're working with a registered investment advisor on your 401k, etc. They are legally obligated to serve you in your best interests. They don't accept compensation from supply side vendors. Okay, hugely important. So that's one way to do it. Now, if you're a bigger business, you can do what Mark Cuban has been promoting, and I agree with him on this point, is hire benefits expertise in-house, right? Put them on your payroll. You could hire someone like me who's an expert in this field and put them on your payroll. And this way you're getting unbiased advice. And it's critically important. I mean, the ROI on doing this is huge.
Where's the break even on something like that? I mean, how many?
So I would say,
how many employees?
Yeah, businesses that have over 1,000 employees, you really want to start trying to find an expert in this space and put them on your payroll.
Yeah, keep them to yourself. Kind of.
Yes.
Yeah.
Yes.
And make them part of your family. Yeah, well, then that's an invaluable thing for smaller businesses. Though they can hire organizations like the one that you founded in 2018.
18. And in fact, if you go to the Validation Institute's website, there is a list of these fiduciary-based management consulting firms. Okay. And so, they all have different flavors, just like anything, right?
Yeah.
But I would encourage your audience to go there, check them out, and find one that's, meets your needs.
Dude, absolutely fascinating conversation. I know I got a little off topic there for a minute. It just, this kind of stuff, you can spend a day
Oh
You
yeah.
could probably spend a week trying to unravel all the threads that lead to all the different various forms of corruption that's happening within that
Yes.
system, and trying to figure out how you can get the best healthcare possible, even though it's not bent towards serving you in the best possible way. So, absolutely fascinating. I know a lot of people are going to really enjoy that. We're going to put all your links, your book, everything in in the show notes. Every connection to you we'll put in the show notes, links, phone numbers, whatever you want to give me, I'll put in there. And dude, we're definitely going to talk again in the future. This stuff fascinates me because it's utterly confusing, and I'm sure if I'm confused, I'm just an average guy. I know that the populace is probably confused.
100%. And just one last point to help motivate your audience too is that, you listen, as a young person, most people don't know this, but 30% of your lifetime income is going towards health insurance and healthcare. It's not
30%.
sustainable. 30% between taxes, Medicare, Medicaid, all that stuff, you add it all up, 30% of your average American's lifetime income. It's not sustainable and it's not necessary. This is a choice. We just have to engage and think about doing things a little bit differently.
Amen. Donovan Pyle, appreciate you being here, man.
Thanks for having me on, Jake.